An Oklahoma Supreme Court ruling that a cigarette fee was unconstitutional has left a more than $200 million hole in the state's budget and led to calls for a special legislative session later this month. While budget negotiations on filling the budget hole continue, healthcare providers are concerned that a failure to raise more revenue could mean devastation for services in rural Oklahoma.
Revenue from the state's cigarette fee was expected to generate around $215 million, primarily for 3 healthcare agencies, including $70 million for the Oklahoma Healthcare Authority. When combined with matching federal funds, agency losses could exceed $500 million if that revenue is not replaced. In calling for a special session, Governor Mary Fallin warned that the agencies and the people they serve would suffer if lawmakers don't find a solution. Nico Gomez is president and CEO of the Oklahoma Association of Healthcare Providers, which represents nursing homes and long-term care facilities in the state. He says additional cuts would be devastating for most of the state's nursing homes.
I talk with nursing home owners every week who say, I'm probably about a 60-day decision on this building in this community. And we're not talking necessarily just Oklahoma City and Tulsa. We're talking rural communities who rely on these facilities to take care of their loved ones and provide employment for people in the area. So this has a ripple effect.
About 70% of the nursing home population in Oklahoma relies on Medicaid to pay for care. But the Medicaid program has been cut by almost $1 billion over the past decade, mostly by reducing reimbursement rates to healthcare providers. Gomez says another cut would have major consequences.
If the Oklahoma Healthcare Authority receives a cut in their revenue and then they have to pass that cut on to their providers, then we will probably close 30 to 50% of the homes in the state.
Gomez says the Healthcare Authority has few options to save money beyond cutting provider rates.
The state can stop paying for transplants. They can stop paying for prescription drugs. They can stop paying for dialysis. Those are not really good options. Those are not options that really even should ever be considered.
While the impact would be most keenly felt at rural nursing homes, even facilities in the state's metropolitan areas would be affected. Adam Stevens is administrator at Sienna Extended Care and Rehab in Midwest City.
It wouldn't be as hurtful, as impactful on us, but it would make a difference in what we're able to provide. It would make a difference in the care that we're able to provide on a daily basis, just with the amount of staff that we're able to offer.
And Stevens notes that any cuts would come on top of reductions made in previous years, making it harder for all facilities to survive.
Every year it seems like we're facing more and more cuts. Last year, I think it was, we went to D.C. and had talked to our legislators there because we were facing a 25% cut, which would be, even for a facility such as mine, would have been closing the door.
It's not just nursing homes that are struggling. Rural hospitals are also facing major challenges. Corey Lively is Chief Executive Officer of the Great Plains Regional Medical Center in Elk City, which has about 425 employees and 45 physicians on a routine basis.
We have been very successful in the last few years at expanding our services and creating an environment where we can deliver health care right here at home, but that is becoming much more of a struggle due to those financial constraints.
Unlike many other hospitals, Great Plains has managed to attract physicians to the area, something that has been notoriously difficult in rural parts of the state.
When they come and interview in Elk City, it's not just about the hospital. It's about the total package that we offer, the quality of life, the ability to deliver health care, and the ability for them to do what it is their chosen profession is, whatever that may be.
Great Plains also recently opened a renovated rehabilitation unit and has the only freestanding cancer center between Oklahoma City and Amarillo, but Lively says further cuts could put that at risk.
That's something that we're taking a look at that might not be an effective delivery model anymore. And I hate that for the residents of our community and in this region because it's the only service like that provided out here, within a 70, 80-mile radius.
Lively says cuts in Medicaid provider rates could also impact their obstetrics unit, which delivers about 40 to 50 babies a month, with about 65% of the patients relying on Medicaid to pay for care.
we anticipate that that will be affected. Now, we don't believe we're going to stop delivering babies, but it certainly makes us take a look at how we do that every day, day in and day out.
While Lively says Great Plains is not in any danger of closing, cuts could shut down other rural hospitals, and that impact would be felt even in the state's urban centers.
If 5, 10, 15, or 20 hospitals were to close in rural Oklahoma over the next 6 to 12 months, which is a real possibility, the metropolitan hospitals would not be able to handle that type of influx.
The Oklahoma Health Care Authority says it is trying to avoid provider rate cuts if possible, and remains hopeful lawmakers will be able to reach agreement on a means of replacing lost revenue.